Neighborhoods and communities across our vast country, at their core, are centered on common needs and services. Quality and access to those services, however, may vary depending on where you live. When it comes to healthcare, those living in cities have better access and expertise available than those in more rural areas where getting to the nearest healthcare facility can take hours and where specialists may be hard to find. The result can be missed or skipped appointments and follow-ups, which can lead to disparities in outcomes. With the technology available today, healthcare systems and innovators have been seeking solutions to start closing this gap. One such team has recently partnered to launch a first-of-its-kind pilot to tackle a regional rural healthcare challenge.
My name is Michael Hasselberg. I'm the Chief Digital Health Officer at the University of Rochester Medical Center.
Hi, I'm Marty Birmingham, President and CEO of 5-Star Bank.
Hi, I'm Jeff Bennett. I'm the Chief Strategy and Innovation Officer at Modivcare.
Julia Millard. I'm the Chief Customer Experience Officer at DexCare.
Hi, I'm Karen Finger with Verizon Business, Global Lead for Connected Healthcare Strategy and Innovation.
What do these leaders and organizations have in common? A shared passion for addressing health inequities, technical aptitude, and a willingness to try something new. Let's listen to their story.
We had a problem in our community. We needed to deliver high quality healthcare into our rural communities, patients where we did not have providers out there. First, we found Verizon, who helped us deliver the connectivity that we needed. Second, we partnered with DexCare that provided us that seamless, convenient, on-demand telemedicine platform to connect my providers with patients in these communities. And third, we partnered with Higgy Health that provided a virtual care station where not only we could deliver telemedicine, but also get vital signs and deliver preventative care. And fourth, we partnered with 5-Star Bank, who gave us trusted locations in these communities to deliver high quality care. We're really excited about this outside of the box thinking. We think that this could be quite transformative to disrupting rural healthcare across the United States.
So 5-Star Bank is a locally headquartered community bank in the Rochester Finger Lakes region. I have the privilege of serving as a volunteer at the University of Rochester Medical Center, serving on their board. And Michael came to a board meeting to provide an update for the board. And when the board meeting was over, I simply walked over to Michael and said, I think we can help. We started a conversation from there and built on it to where we are today. So with this program, our branch network overlapped their physical presence in a very unique way. So in building our conversation with Michael and his team, it became very clear that there is a very strong link toward financial stability and economic vulnerability and access to healthcare. We've been very impressed with the technology that Higgy and Modivcare have been providing in support of this program. Higgy machines are out in the world, but these Higgy machines are connected to world-class healthcare that wouldn't otherwise be delivered at that time and at that place to a patient in need.
Modivcare is the leading provider of integrated supportive care to help people stay in the home and stay in their community. We provide services such as non-emergency medical transportation, personal care services in the home, monitoring people virtually to allow them to stay at home, and also virtual visit stations to bring access into the community. The problems that people face in rural America is a limited access to broadband. I mean, 17-18% of people do not have broadband in rural America. People in rural America don't have access. There's not providers. They drive 20 to 30 miles longer to get to a doctor, so they may not be able to get to a doctor. So our services, whether they're transportation and bringing you to the doctor, the virtual health station that we work with Verizon and UMC and DexCare on, brings the doctor to the community. So instead of you having to go to the doctor, it brings it to the community. Our services really are addressing the core issues in rural America by letting someone stay in the home, stay in their community, and bring the health system to their community. And then if necessary, bring them back to the health system, which many times is 20 to 40 miles away from their house. So we were working with Verizon, and Verizon was contacted by UMC. and said, we're looking at how to bring access to care into rural America. And our Verizon point of contact said, I have a company I need to introduce you to. And so we got connected to this through our Verizon relationship and investing in really bringing access to the community and to the home. And so technically what the station does is it does a lot of things that you do when you go to the doctor's office. It allows you to provide your contact information, fill out your health profile, your name, gender, other basic information, fill out that clipboard of the conditions you're managing and the reason for the visit. So that same design theory was built into this flow, but now we've unlocked with DexCare, supported by Verizon's connectivity, is now you can actually talk to a doctor at UMC. So it brought the doctor, not only can you take your blood pressure, your weight, and fill out your assessment, which we could do before, now we actually can get a live doctor on the line, so you could actually talk to them and address your issue right there. What we ran into in rural America, what's in every rural town that's still thriving is a bank. And that bank has trust. They have trust that they built over the year. They have community investment, because really the bank only survives if the community is thriving. And so they're key in this whole thing around not only your financial health, but also your personal health. It's time to get creative about addressing access to care in rural America.
DexCare is a care access and capacity platform, which means that we are addressing the growing supply-demand mismatch in our healthcare system. So at DexCare, we envision a world where everyone, everywhere has exceptional access to the best expertise to treat, prevent, and cure illness. And that absolutely includes those who reside in our rural communities in the US. And so when Michael Hasselberg, the Chief Digital Officer at URMC, heard of this opportunity and wanted to explore how he could bring care closer to the people in the rural communities in the form of a virtual visit, we were, I think, the easy choice or the obvious choice in that case. So it would ensure by putting our platform and product into the Higgy workstation that the workflow and the operations that were in place for the provider group at URMC were exactly the same as they were before. So when we think of other rural communities in America, they don't all look exactly the same. So we need to be able to understand the feedback from this initial pilot, what we can replicate across rural communities and what needs to be tweaked. And then once we have that in place, it should be easy, right? It's really identifying what those the key nexus points are within the communities to see where we can go and how we can expand this across the US. So I think this is incredibly important within those rural communities that healthcare is local. And so this isn't kind of any doctor on the other end, but it's a doctor from a system that you know and trust, and you kind of have an immediate connection to the care that you're about to receive. We, with this alliance and this partnership, are able to truly bring care to the people where they reside, regardless of where they reside, whether or not they're in an area that has a digital divide or not, right? It is being able to really come close to the patient and meeting them where they are. I hope we just knock it out of the park with the pilot. So I think in terms of success, right, it's being able to actually kind of see volume, see patients coming in and starting to use the system, able to track their journey so that we know that they're getting the care that they need and want, and it is seamless and easy, and that it just works for them. We couldn't do this partnership or this alliance without each of these 5 players.
Verizon has a big role to play in healthcare. We've got the network assets, we've got our partnership ecosystem, we've got our security assets. We're really taking all that and building that connected healthcare platform as a service where we're connecting patients and providers together, delivering data from the med tech devices, enabling those and capturing that data, delivering it in near real time to clinicians so they can make critical clinical decisions at the point of care. We're working on a lot of health equity programs where we're working with health systems and payers to bring access to care into communities, into underserved communities, and into the home. So one of our big areas of focus for Verizon is our investment in the network, and that is really the critical connective tissue that enables the clinical applications and the operational applications within the healthcare system. So we've made tremendous investments and tremendous strides in delivering coverage out to the communities. 4G, which everybody's very familiar with, has 99% coverage across the United States. 5G is rapidly catching up, where, especially with our C-band investments, and we've invested heavily in the rural communities with our C-band spectrum to deliver that connected experience for patients to connect to providers. So we're really excited about that. And more as we talk to health systems, they're really embracing health equity and the role that we can play as a partner to them. Power of partnerships is really incredible and exciting. And I met Michael Hasselberg, the Chief Digital Health Officer, really actually through LinkedIn. He reached out, wanted to ideate on how he, for his health system, could bring access to care to their rural populations in New York. And so we were ideating. He was talking about how do we bring like a clinic in a box to a physical footprint and connect that together. And through that, as he was talking and I was listening to what he wanted to do, I, in parallel, had been working with Higgy, a Modivcare company, to power their health station, their next generation health stations, which is going to have telehealth and needed better, improved connectivity. And so I brought Higgy forward into the mix, and we started talking. And then through that, Michael knew some executives at Five Star Bank, and then DexCare was already serving URMC. So the five of us continued to collaborate and get together to deliver this really unique, first of its kind pilot, leveraging the bank locations to bring access to care. I think we just all had a shared passion and advocacy for a couple of things. I mean, definitely like bringing healthcare to underserved communities that don't really have access to a primary care physician or ongoing chronic care management capabilities, but also a shared passion for helping the health systems innovate and better serve their patient populations. We are an innovation team, and so just that passion for how do we work together to solve problems and try new things and incubate new things is unique. Is unique for Verizon. So please reach out to us, and maybe we can help you iterate on how to reach your patient populations.
And that's a wrap. Stay tuned to this space and to these organizations for updates and the evolution of this pilot and for rural healthcare access.